Estrogen is a primary female sex hormone which is produced by the developing follicles of the ovaries, corpus luteum, placenta, and it is also produced by adrenal gland and testes in small amounts. During the first phase of menstrual cycle, that is the menstrual phase, estrogen is produced by the granulosa cells of the ovaries. During the first phase of menstrual cycle, that means during the first 5 days of the menstrual cycle, estrogen is produced by granulosa cells of ovaries by aromatization of the androgen. By which mechanism? By aromatization of androgen. That means testosterone is converted into estrogen with the help of enzyme aromatase. That is called as aromatization of androgen. That androgen is derived from theca interna cells in the ovarian follicle. And major estrogen we have estradiol, estrone and estriol. These are the major estrogen, or we can call them natural estrogen. So how these natural estrogens are synthesized or produced or generated? Dehydroepiandrosterone is converted into androstenedione. This androstenedione is converted into estrone with the help of aromatase enzyme, and androstenedione is converted into testosterone. Now this testosterone is converted into estradiol with the help of again which enzyme? Aromatase. That means there is a ring A aromatization and there is a formation of estradiol, estrone and estriol. Now we have synthetic estrogens which is classified into steroidal and non-steroidal. In synthetic estrogen we have steroidal and non-steroidal. So in steroidal we have ethinyl estradiol, mestranol, tibolone, and in non-steroidal we have diethyl stilbestrol or DES or dinesterol, which is given topically. Now what are the various pharmacological actions of estrogen on female reproductive tract? Estrogen is concerned with the female reproductive tract development. That means it is concerned with growth and development of the sex organs in the female. Growth and development of the sex organs in female. Development of the secondary sexual characters in female. Proliferative phase of endometrium. Proliferative phase of endometrium, that means it stimulates pre-ovulatory phase of endometrium. What does it do? It stimulates proliferative phase of endometrium. It makes cervical secretion thin, watery and alkaline. It makes cervical secretion thin, watery and alkaline to facilitate the entry of spermatozoas. For what? To facilitate entry of spermatozoa. It also causes rhythmic contraction of fallopian tube and myometrium. It causes rhythmic contraction of fallopian tube and myometrium. It also acts on the breast and it stimulates the growth of duct and stroma inside the breast tissue. Metabolic actions on the bone, particularly it inhibit bone resorption. It inhibit bone resorption means anti-inhibit bone resorption, anti-resorptive activity, and fusion of epiphysis, and it maintains the bone mass. It maintains the bone mass It causes fusion of epiphysis and it inhibits bone resorption. It is essential for the normal structure of skin and mucous membrane. It is beneficial or it is helpful in the normal structure of skin and mucous membrane. There is an action on cholesterol also. It increases the healthy cholesterol, that is HDL, and it decreases the lethal cholesterol, that is LDL. That means it increases the HDL LDL ratio. As far as blood is concerned, it increases the clotting factors like 2, 7, 9, 10, and it decreases the antithrombin 3. That means it increases the coagulation of the blood or coagulability of the blood. Now, what is the mechanism of action of estrogen? For the mechanism of action, we should know that estrogen acts on the estrogen receptors. Estrogen acts on the estrogen receptors. So there are two types of estrogen receptor, estrogen receptor alpha and estrogen receptor beta. So estrogen receptor alpha, we have that estrogen receptor alpha are present on the uterus, vagina, breast, hypothalamus, blood vessels, and estrogen receptors beta are present on the prostate, ovaries. Now, how they act, mechanism of action of estrogen or estradiol, what they do, they diffuses across the cell membrane. They diffuses across the cell membrane. It binds to the estrogen receptor protein. What they do, they binds to the estrogen receptor protein, forming hormone receptor complex, estrogen receptor complex or hormone receptor complex. That complex interacts with the DNA, and after that estrogen receptor DNA complex interacts with the activator proteins in the target genes or estrogen receptor proteins which are present on the target organs or target genes, and that's why there is a transcription of mRNA and hormone regulated genes, and because of that there is a protein synthesis in the cytoplasm that results in the cellular activity or that results in the effect. Why there is a protein synthesis in the cytoplasm and there is a result in the cellular activity or effect? Because there is a transcription of mRNA and hormone regulated genes. Why there is a transcription of mRNA? Because of estrogen receptor DNA complex interacts with the co-activator proteins in the target genes, or we can say estrogen receptor proteins which are present in the target genes. Why is it so? Because that estrogen receptor protein forming hormone receptor complex interacts with the DNA. Because of that, estrogen diffuses across the cell membrane. So that is how estrogen acts. Now, the pharmacokinetic properties of the estrogen, we can administer estrogen via various routes like oral, parenteral, transdermal or topical. Natural estrogens are not administered orally because of high first pass metabolism. Why it is not administered orally? Because of high first pass metabolism. Synthetic estrogen, they can administered orally or they are orally effective and they are longer acting. LA means they are longer acting as compared to natural estrogen. These estrogens are highly bound to the plasma proteins, especially the globin. They are metabolized in the liver with the help of glucuronide and sulfate conjugation. They are metabolized in the liver with the help of glucuronide and sulfate conjugation. Metabolites are excreted in the bile and urine. And there is a enterohepatic circulation or enterohepatic cycling occurs, and that's why it increases the bioavailability of estrogen. Because of there is a deconjugation occurs because of bacterial flora, and again they are reabsorbed. That's why there is a enterohepatic circulation or enterohepatic cycling. So where we use this estrogen, therapeutic uses of estrogen, we use estrogen for the contraception, which is the most common use of synthetic estrogen in combination with the progestins. Contraception is a reversible method of contraception, and generally we use combined pills. Combined pills means estrogen as well as progesterone. We know that we have various drugs like Mala N, Mala D preparations in which there is ethinyl estradiol along with norgestrel, means estrogen as well as progesterone we have. So how they act, what is the mechanism of action they have? They inhibit the FSH and LH release. They inhibit the gonadotropins release, or we can say FSH, that is the follicle stimulating hormone or luteinizing hormone, by negative feedback mechanism on the HPA axis. By negative feedback mechanism on the HPA axis. They also inhibit ovulation. They inhibit fertilization. They inhibit implantation. What does that mean? It makes endometrium unsuitable. It makes the endometrium unsuitable for the implantation, and it also inhibits the sperm penetration because of particularly the progestins we have. Now, it is also used in case of hormone replacement therapy. The main indication of hormone replacement therapy is postmenopausal hormone replacement therapy. Signs and symptoms are due to cessation of normal ovarian function. Signs and symptoms are due to cessation of normal ovarian function, and vasomotor symptoms like sleep disturbances, genital atrophy, osteoporosis, hot flushes, night sweating, depression, irritability, sleeplessness. These are nothing but the vasomotor symptoms. There is increased chances of cardiovascular diseases in postmenopausal phase because of cessation of normal ovarian function. That's why the short-term estrogen therapy is helpful in case of hot flushes, night sweating, depression, irritability, sleeplessness. But long-term therapy is used to prevent and delay osteoporosis and atherosclerosis and cardio-arterial diseases or coronary arterial diseases. This hormone replacement therapy, they have some drawbacks, like there is increased incidence of venous thromboembolism, there is a cholelithiasis or gallstones, dysfunctional uterine bleeding, and mood changes and breast cancer. What are the other uses of estrogen? We have senile vaginitis. We can use topical estrogen like in senile vaginitis we can use topical estrogens. Delayed puberty in females or delayed puberty in girls, estrogen are used to develop secondary sexual characters, particularly in Turner syndrome or hypopituitarism. It is also used in case of CO prostate. It is an androgen dependent tumor, and estrogen antagonizes the action of androgen. That's why we can use estrogen preparations in the CA prostate. In males, dysmenorrhea, it helps in dysmenorrhea because of that it suppresses ovulation. And unovulatory cycles are generally painless. That's why it is helpful in case of dysmenorrhea. Adverse effect of the estrogen like nausea, breast tenderness, migraine, hypertension, there is increase in the blood pressure, hyperpigmentation, cholestasis, decreased libido, gynecomastia, feminization in the males because of particularly those who treated for CA prostate. In postmenopausal women, there is occurrence of irregular bleeding or dysfunctional uterine bleeding, endometrial hyperplasia or endometrial carcinomas, thromboembolic incidents are increased, gallstones. Teratogenicity is most important thing. When it is given to the pregnant lady, there is occurrence of cervical or vaginal carcinomas in their offsprings and genital abnormalities in their male child. There is also increased incidence of endometrial and breast carcinomas because of estrogen preparations. That's it for today. Thank you.